Welcome to Local Discovery, a spotlight on health. It's the show that travels the country in search of answers to how we can all live healthier, happier, more stress-free lives. I'm Kristen Martin, and today I've returned to sunny Tallahassee, Florida to meet with the professional team that is Tallahassee Memorial HealthCare. For the next half hour, I'll be quizzing the doctors, polling the nurses, and speaking with patients to get the information that you're looking for. From successful weight loss management and comprehensive cancer care to neurosurgery, the medical improvements in ankle and knee joint replacement, the benefits of patient navigators, and much, much more. If it will shine a spotlight on your healthcare concerns, then you can find it right here first on Local Discovery, a spotlight on health. Let's get started. We're going to start today's program by discussing a national epidemic that has seen dramatic increase over the past 20 years, obesity. According to the Centers of Disease Control and Prevention, more than 1/3 of U.S. adults, 35.7% to be exact, is currently considered obese. TMH understands the difficulties of weight loss management and has taken a very proactive, comprehensive approach when it comes to a total weight loss solution. And you can find that solution right here at the Bariatric Center. To learn more, we're going to head inside to talk with Dr. Kane. Dr. Kane, I know that being overweight can be very dangerous to someone's overall health. What types of health conditions are related to obesity?
Almost every single condition that you can think of can be related to obesity. The most common are what we call metabolic conditions: diabetes, hypertension, heart disease, things like that. But we see a lot of pulmonary disease with sleep apnea and restrictive lung diseases. We see GI, we see fertility issues. There's even increased risk of certain cancers and even Alzheimer's.
Now, the Bariatric Center, the approach here is very comprehensive. So when we talk about a comprehensive weight loss program, what are we talking about exactly?
Well, we do things quite differently than most doctors' offices because we work in a team. Obesity is a very complex problem, and so we need more than just the MD to fix this. I evaluate the patients as far as their medications, their medical problems, their medical risk, and we come up with a plan. But in order to implement that plan, they need dietitians to teach them how to eat, when to eat. They need therapists to help work on behaviors. We also have exercise physiologists, and so they're going to teach you how to exercise. It's really easy for doctors to say, eat less, move more. But if you don't tell people how to move, they're not going to do it because they do have bad backs and because they are carrying 100 or 200 extra pounds and they're going to hurt themselves. And so we have to teach them how to exercise safely.
So in talking about the help that you're able to give your patients, are there some new technologies that are assisting with the weight loss journey?
Yes, we definitely have some different machines than most doctors' offices. We use bioelectrical impedance scales, which send a current through your body to give us a body composition. And then another machine that is new to our area is the MedGem calorimeter.
Here at TMH Bariatric Center, we're very fortunate to have the MedGem. If you think you've seen this technology before, it's probably because you have. It's also used on The Biggest Loser, and we found it to be a very helpful device in helping people to lose weight. This machine is very individualized in that you're breathing into the machine for about 10 minutes, and then once it's finished, it gives us your individualized metabolic rate, which we can compare to a calculated rate, and that way we will know if you have a high metabolism or a low metabolism. And it helps us to determine the amount of calories that you should be taking in to help you to lose weight. Our patients are having great results because of the MedGem, because we were able to actually get a person's individualized metabolic rate, not just using calculations to determine what it should be, but what it actually is.
Dr. Kane, would you mind sharing some of the success that you're seeing here at the Bariatric Center?
Absolutely. We see a lot of success here. Sometimes it's the patients coming in saying, you know, I can get dressed easier, I don't have to take a break, I can tie my shoes. We love it when patients say, I can go back to work now, I was unable to work before. And sometimes it's obvious clinical improvements, like patients coming off of insulin, not having to do finger sticks or use needles, see doctors so frequently, is really an improvement in their quality of life.
My entire life I've battled, pretty much from adolescence on, battled obesity. For the last 25 to 30 years, I've just been unable to lose weight effectively at all. Then I came up and I got with the Bariatric Center, Tallahassee Memorial. The OptiFast program was offered after an examination, and to my pleasant surprise was a complete success. I started in October of 2011 and went through an 18-week program in which I lost in excess of 52 pounds. I lost 3 3/4 inches in my neck, 8 inches in my abdomen, and basically gained my life back. I'm able now to bend over and tie my own shoes in the morning, and that's pretty neat. That's a goal that I haven't been able to do in 10 years. So as far as I'm concerned, this program and this team has saved my life.
If you've always considered the weight loss journey to be an individual effort without the benefit of medical or technical assistance, then you'll be very interested to learn more about the revolutionary gastric sleeve procedure. Also known as the vertical sleeve, the gastric sleeve procedure reduces the size of the stomach by creating a thin vertical sleeve. This sleeve-like stomach shape reduces the portion of the stomach responsible for producing ghrelin, a hormone that stimulates appetite, leaving the patient with a smaller appetite and a stomach capacity approximately 1/10 of its original size. This laparoscopic technique is less invasive than traditional bypass surgeries, resulting in a shorter hospital stay, faster recovery time, smaller scars, and less pain than open surgical procedures. With the average life expectancy creeping into the 80s, and with our senior population remaining more and more active into their aging years, it's now more important than ever to have reliable, successful joint replacement options. Tallahassee Memorial recognizes this need, and with the help of the iTotal knee and the InBone ankle, they'll have you back on the golf course before you know it. Here are Dr. Thornberry and Dr. Geyer to tell you more.
We're seeing a great increase in joint problems in our senior population due to excessive obesity, plus just the general extra activity of our seniors. People are ready for joint replacements when they can no longer perform their normal activities of daily living without substantial amount of pain, and their quality of life has been lost. The iTotal knee is a custom-made total knee designed for the individual patient. It is not a male-specific or female-specific or a custom cutting block. It is an actual knee replacement made custom for each individual patient. We're going to get a much more natural feel to the knee. I would consider this a high-demand knee for someone who wants to do more with their knee replacement than a standard total knee replacement patient. We're very honored that we're one of only 15 centers that was initially selected to introduce this new technology, and one of only 2 here in North Florida. We have been doing this since late 2011, and our results have been very encouraging, as well as the results of the other pioneering centers in the country.
For many years, people with hip and knee arthritis have had the option of total knee and hip replacements for treatment. That option was not available in the United States for ankle arthritis until more recently, when the technology has finally caught up with that of hip and knee replacements. Today, an ankle replacement is an option for people suffering from debilitating pain due to ankle arthritis. The primary benefit of an ankle replacement over treatments in the past is that it allows the maintenance of normal motion of the ankle. This allows people to walk more normally and maintain an active lifestyle a little more easily than they did in the past with an ankle fusion or a brace. Basically, the worn out portion of the tibia or upper ankle joint and the worn out portion of the talus or lower portion of the ankle joint are replaced with 2 metal pieces. These 2 metal pieces then have a piece of plastic that's placed between them, and that slides, allowing the ankle to maintain its normal motion. In orthopedics, we are realizing that one size does not specifically fit every patient, and therefore, just like in knee and hip replacements, ankle replacements are designed to fit multiple patients.
My knees were killing me. I could barely walk on some days. Some days I was fine. Some days I would be in the middle of walking and all of a sudden something would give and I could not straighten my left leg. I had bilateral total knee operations about 2 weeks ago. But since then, every day's been getting better and better. And the one thing I do notice is I don't have the referred pain to my hips any longer as a result of walking funny with my knees. So I'm delighted to have had this surgery, and I'm glad I did them both at once. The physical therapy I am currently going through is just amazing. It's in different components. They take different steps along the way, but when you put it all together, it means I can walk, and I'm walking. It's 2 weeks after surgery. I'm walking. I am looking forward to getting back to being my normal self and getting exercise, walking, not having to worry about my legs giving out from underneath me, being able to get in shape, lose weight, get toned, get conditioned, have my cardiovascular exercise so I don't have to worry about relying on a lot of medications as I get older.
Dr. Hutchinson, we've just learned quite a bit about recent advancements as far as joint replacement goes, but successful orthopedic care involves much more than just the equipment. So how is patient knowledge helping you see success in what you do on a day-to-day basis?
Well, patient knowledge is really important for orthopedic care. It's very important that the patients have realistic expectations and real knowledge about their condition, their treatment, and their rehab afterwards to be involved in their care and have good outcomes.
Now, TMH has just embraced a program called Own the Bone. What is that?
Well, Own the Bone is a program that's been started by the American Orthopedic Association to help treat fragility fractures. There are over 2 million fragility fractures a year in this population, which is more than heart attacks, strokes, and breast cancer combined. And we're just seeing the beginning of this epidemic of fragility fractures or fractures related to osteoporosis. This is a program that involves both patient education, patient identification, and communication with other physicians in the region.
So you're giving these patients then tools to hopefully prevent such a fracture?
Yes, we're identifying when they have their first fracture because once you have your first fragility fracture, you're 50% more likely to have another one related to the osteoporosis. So we're identifying these patients at their first fracture to hopefully prevent further fractures.
And how do you judge the success of a program like this?
With numbers. We're going to be monitoring these patients, collecting data on them, and hopefully we will be able to prove here at our hospital that it's as successful at preventing secondary fractures as it has been in other hospitals around the country.
All right, great. Well, thank you so much for talking with me. It's a really interesting program that you're working with. And when my knees start to say no to tennis, I'm going to come and see you.
All right, thank you.
Hearing the words, "you have cancer," is not only a shock, but it's a life-altering event that can leave you feeling scared, vulnerable, and oftentimes alone. Tallahassee Memorial understands what it's like to hear the diagnosis of cancer, and they've created a powerful cancer care system that combines the compassion and expertise of their cancer team with some well-advanced, top world-class technology. And it's all right here under one roof at One Healing Place. Dr. Brosicker, I know that One Healing Place is relatively new to Tallahassee Memorial Healthcare. What's the focus of this facility?
The focus is being able to provide comprehensive, state-of-the-art care to patients with both cancer disorders as well as blood diseases.
And the second floor has recently opened. What has that area added to your patient care?
Well, we now have expanded office space that allows us to see patients in a much more comfortable and pleasant environment. We have a new infusion area now for patients to get their treatments. We've got a pharmacy here that allows us to provide their medications very quickly. We have our own laboratory here that provides quick turnaround on blood testing. It centralizes what we do in the outpatient setting, so patients can kind of see this as the place to go relating to their treatment and their care, not just their medical treatment, but we have patient navigators, we have a full-time dietitian here to provide nutritional counseling, we have a full-time social worker, and all of the other people that help with all of the needs that these patients have.
Oncology is the wholesome care for patients with cancer and with blood cancer disorders. care for cancer patients is not only medical treatment provided by physicians. It also includes emotional and spiritual support, physical support, and financial support. Cancer Center at TMH provides that for all of our patients, and that is the beauty of the TMH Cancer Center.
So the area of hematology, which a lot of people don't realize, is really tied very closely to cancer care. It's really important that you're part of a comprehensive cancer care team that not only recognizes this point, but also appreciates how blood disorders can really affect cancer care. And to have a cancer center such as the one here at TMH, to have comprehensive expert physicians who not only know their field very well, but who also really are invested into this community and caring for the patients who live here, who work here, who are family members, friends, and colleagues. So to be able to get all those services in one place not only benefits the physicians and allows us to take better care of those patients, but it also benefits the patients in being able to get their care closer to home.
From the minute you walk through the doors, you can tell that this is a different type of facility. It's very inviting, it's very peaceful. That must be intentional.
Definitely. We wanted to try to avoid any sort of an intimidating, cold, sterile environment, providing a more homey type of environment, a more comfortable environment, a beautiful environment. Just makes this journey that patients have to go through a little bit easier. We've got a beautiful healing garden outside, and all of that together, I think, just is a helpful thing for us as caregivers, as well as we want our patients to experience that.
All right, great. Thank you so much for sharing One Healing Place with me. And before I let you go, I'm really curious about these patient navigators. Can you point out one to me?
Sure, Sandy's right upstairs. We can go see her now.
All right, thank you. Excuse me, are you Sandy?
I am.
Good. Dr. Broseker thought it might be okay if I asked you a few questions about your position here.
Oh, please.
So you're a patient navigator. I don't know what that means. Can you explain that to me?
Absolutely. And I understand why you don't, because this discipline's only been around for 7 years. So a navigator tries to meet a person early in their diagnosis. We think of patients as being dropped in a foreign country, unable to speak the language, unable to know what direction to go.
Do you work primarily with the patient, or are you also helping out with their families and loved ones as well?
Cancer is a disease that impacts everyone. Hearing your name and cancer in the same sentence is terrifying. And so supporting the family, teaching them how to help their loved one, providing support and information for them is a big part of what we do as well.
Now, dealing with cancer patients on a day-to-day basis, I'm assuming this is a very rewarding position for you.
Absolutely, and we see patients at their very best in very difficult times, incredible courage, and they give back. We have a woman who every week now brings flowers to the center so that other patients can have that pleasure. And the other day I was talking to someone, we finished our session, and she looked at me with tears in her eyes and said, "I thought I was alone in this, and now that I know you're going to walk through this with me, I don't feel so alone anymore."
Medical advances are being made every day in the treatment of cancer. And now with the Novalis TX radiosurgery system, patients can expect shorter treatment times in an outpatient setting. A surgery that doesn't involve cutting, scarring, or bleeding, and procedure precision that's never been seen before. The Novalis TX radiosurgery system delivers non-invasive cancer treatment that takes as little as 15 to 20 minutes per treatment. This one-of-a-kind shaped beam technology can treat cancerous and non-cancerous conditions of the entire body. Shaping the beam precisely to a patient's tumor ensures that the best possible treatment dose is delivered while healthy tissue is protected. As one of the most advanced cancer treatment options available, Novalis TX radiosurgery is changing the face of cancer treatment and has already helped thousands of people continue to go to work, spend time with family and friends, and take part in their favorite activities, all while fighting cancer. Now that One Healing Place is completed and patients are receiving the best cancer care treatment in the Big Bend region, TMH has set out to fill another healthcare void, a comprehensive neurovascular center with the ability to offer both open and endovascular procedures. Here's Judy Greenwald to tell us more. Hi, Judy.
Hey, Kristen.
So what's been going on in this area that has made this a top priority?
Those patients that were in need of complex neurovascular services were having to be transferred to medical facilities that were like 2 and 3 hours driving distance, and those patients, most of those patients were actually having to be life flighted to those facilities.
And what do you anticipate will be the need for such a center in this region?
This past year, we actually had between 75 and 100 patients who had ruptured aneurysms that had to be transferred to those facilities that were located 2 to 3 hours driving distance from our area. And what that means for the patients, once they go to those facilities and have a complex neurovascular procedure done, they usually have to stay 14 to 21 days as an inpatient. And that's a long time to be away from your family and the community. What we're planning is to build a neurovascular suite at Tallahassee Memorial Hospital. But we really could not execute that plan until we had our quarterback come on board, Dr. Matthew Lawson. And we are now have built a beautiful state-of-the-art neurovascular suite, which will be able to offer treatment options for those complex neurovascular patients as well as diagnostic procedures.
Sounds to me like you have met your quarterback.
Absolutely.
In order to learn more about the neurosurgery team here at TMH, Dr. Lawson has agreed to talk with me in his office. Thank you so much for your time. Now, I understand that you are new to the team here in neurosurgery. Why is this a really appropriate time for you to be joining on?
Well, this is a great time for me to join the team here at Tallahassee Memorial Hospital because the hospital has taken a huge step forward in adding cerebrovascular surgery to its services offered, and that's my expertise, so it was a great time to join this institution.
Now, you said cerebrovascular surgery. What is that exactly?
Well, cerebrovascular surgery traditionally was open surgery performed by a neurosurgeon where they'd make an incision on the head and go through the skull to treat disorders of the blood vessels of the brain, such as aneurysms or AV malformations. But really over the last 15 years or so, there's been a dramatic rise in endovascular neurosurgery, and that's what I've been trained in. And that includes treating disorders of the blood vessels of the brain from inside the artery. So it's a minimally invasive approach to the same disorders.
So is that the primary benefit then, the minimally invasive approach?
Absolutely. With traditional surgery, there's a large incision, there's exposure of the brain tissue to get down to the blood vessels that are being treated. With endovascular therapy, many times we can treat those exact same disorders from the inside, sparing the exposure or trauma of traditional surgery.
And do these procedures require new technology then for TMH?
Yes, these procedures are performed in an endovascular suite that we just built here at the hospital, and it's a very capital-intensive process. It's been under construction for a while, and we're very happy that it's open and running.
And the end goal then is a comprehensive stroke center?
Yeah, the goal here in the next year is to have a comprehensive stroke center where we can provide 24/7 around-the-clock coverage for the treatment of acute stroke. We can assess those patients quickly in the emergency department, provide medical therapy, and then if needed, take them quickly to the cath lab for intervention on their acute stroke.
Well, that's incredible. Thank you so much for your time, and good luck in your new position here. I have to say, I'm always impressed with TMH's commitment to technology.
Thank you.
We're going to close today's program with one of the most quickly evolving fields in healthcare, cardiology. But before we introduce you to the Heart and Valve Center and the newest non-surgical treatment for valve replacement, I've asked Penny Burrows, a cardiovascular nurse, to quickly go over the symptoms to watch for as indicators of heart valve problems. Penny?
There are 6 main indicators with problems with your heart valve. Those can be shortness of breath. That can be whether you're at exercise or when you're laying down at night. You may need pillows to prop yourself up on. Weakness or dizziness, passing out can also be a symptom there. Palpitations or an irregular heart rate. Discomfort in your chest or pain in your chest. Swelling in your ankles, feet, or abdomen. And then a rapid weight gain can also be an indication. If you have any of these, please contact your healthcare provider.
Thank you for that reminder. I know how important it is to keep those symptoms fresh in our minds. And now to learn more about the recent advances in cardiovascular treatment, I've caught up with Dr. Knoll in the Cardio Hybrid Lab. Hi, Dr. Knoll. Thank you so much for your time today.
Good morning.
So I understand that the Heart and Valve Center here at TMH is really at the forefront nationally when it comes to cardiovascular care. What do you think is setting you apart?
I think the opportunity that we provide in a cohesive group, being non-invasive cardiologists, interventional cardiologists, and cardiothoracic surgeons, providing comprehensive collective care.
Now, when we talk about comprehensive care, I saw some of the offerings, your programs and your treatments online. There's quite a bit there. Can you list some of those?
Absolutely. We provide angioplasties, carotid stenting, coronary angioplasties and stentings, and we're also moving towards percutaneous aortic valve replacements.
All right, now that sounds like something I wanted to ask you about next. In your field, there are so many breakthroughs, medical advances happening really quickly now. What are some of those breakthroughs?
Well, percutaneous aortic valve replacement is the newest technology that's being offered. This is an opportunity to replace an aortic valve that's not working appropriately and do so in a manner that doesn't require open heart surgery.
A transcatheter aortic valve replacement, or otherwise known as TAVR, is a procedure in which we replace the aortic valve, a major valve on the left side of the heart, through a minimally invasive technique where we access the groin and implant the valve through the groin. This is different from the standard operative procedure where we open the chest, have to put the patient on a heart-lung machine, and then replace the valve surgically. So this is a new procedure that is less invasive and offers a different modality to treat these patients who are high risk for surgery. I think a picture's worth 1,000 words, and so we do try to draw a picture for the patients, use models and demonstrate what we'll be doing. A lot of patients understand the notion of a heart catheterization procedure, so they generally understand how we access the heart from the groin to do standard procedures like stent procedures. And we just expand on that knowledge base and tweak it a little bit so that they can understand how this relates to treating the aortic valve. The average length of stay for this procedure is about 5 days. So it is still a very major intervention for these patients, but we still feel that it offers a lot of advantages in the right patient to an open procedure in that the recovery in many cases is less arduous for the patient and oftentimes less in terms of hospitalization days.
So when we're talking about these medical advances, what does this mean for your patients? Are they able to live longer, more fuller lives?
Sure. These are patients that have been turned down for surgery, so if they didn't have anything done, their survival would be less than 50% over 2 years. Because we're now able to offer this procedure, we improve not only their quality of life, but the longer they live.
All right, now as a cardiologist, what would you say is the most rewarding part of your day?
I think impacting patient lives always is the most rewarding, but providing new opportunities that patients previously couldn't have is a new challenge for me.
All right, great. Thank you so much for your time. I know you're very busy.
Thank you.
I'm sorry to say it, but that is all the time that we have for today. But if we do need to wrap up the show, I have to say that ending in this beautiful healing garden is the perfect note to end on. Now, before I go, I would like to thank the many healthcare professionals that took time out of their busy schedules to meet with me today. I know that I'm feeling better informed about my healthcare options, and I hope that you are too. Now, if you'd like to see any of the program that you've just seen, you can go to our website. It's localdiscovery.tv. Just click on the Spotlight on Health button. Or if you'd like more information on some of the subjects that we covered in today's program, go to the Tallahassee Memorial Healthcare website. It's tmh.org. For now, I'm off in search of more answers to how we can all live healthier, more active, carefree lifestyles. I'm Kristen Martin. Thank you so much for watching this edition of Local Discovery, a spotlight on health.